Good morning. If you have decided to study to become a professional hypnotherapist, follow us in this beautiful project of study and learning. Hypnosis is a powerful technique with which you will be able to help and improve the quality of life of a great number of your future patients. Remember to study the description of this video, where you can find a link on clinical hypnosis, with several free ebooks also free. The problem of obesity. Obesity is the most frequent metabolic disease in the world. Both overweight and obesity are major public health problems and can be defined as an excessive accumulation of fat, in general or localized in the body. How to tell if we are obese? A person is considered to be overweight when their body mass BMI is between 25.0 and 29.9 kilograms per square meter, and those who have a BMI major than 30 kilograms per square meter are obese. The appropriate weight can be estimated from this BMI or Kettleth's index. We need to know the height and weight. BMI is a person's weight in kilograms divided by the square of height in meters. It's an index of adiposity and obesity. For an adult person, an adequate BMI is considered to be between 19 and 25. Keep in mind that BMI is not a direct reflection of. For many people, overweight means excess fat, and, however, this is not always the case. Athletes with dense bones and well-developed muscles, they could be overweight according to the index we are discussing. However they have little fat, a bodybuilder can be classified as overweight, even if he has not fat, and the same way, a tiny Chinese gymnastic would be included in the underweight range, even if she is completely healthy. On the other hand, inactive people, very sedentary, may have an appropriate BMI, when in fact they probably have too much fat. An additional criterion for obesity related to an increased risk to health is the amount of abdominal fat. Central fat distribution may be even more critical than total fat as a risk factor for chronic disease. It is highly correlated with a higher prevalence of glucose intolerance, insulin resistance, increased blood pressure, and increased blood lipids. The anthropometer that assesses fat distribution is the waist circumference, hip circumference ratio, WHR. A high figure, generally more frequent in men, reflects android or central obesity, with fat deposited preferentially in the abdomen and upper body, and may pose a greater risk to health. A low figure, more characteristic of women, peripheral fat deposits in the hips and thighs, gynoid type. Waist circumference is also used as an indirect measure of abdominal fat, and is recommended for use along with BMI to predict risk. A waist circumference of more than 88 cm for women than 102 cm for men indicates an elevated risk. Obesity can be considered as a chronic disease of a complicated nature, affecting a considerable percentage of the population. It is a risk factor in cardiovascular disease, insulin resistance, type 2 diabetes, high blood pressure, and in certain types of cancer. In fact, weight reduction results in a significant improvement in diabetes, blood, and general sense of well-being. For many people, it is also an aesthetic issue that can lead to psychological and social problems. Potential benefits of a weight loss of around 10 kilograms. Blood pressure. Decrease of 10 milligrams mercury in systolic blood pressure. 20 milligrams mercury reduction in diastolic blood pressure. Diabetes. Reduction in fasting glucose levels by about a half. Plasma lipids. 10% reduction in total cholesterol. 15% reduction in LDL cholesterol. 30% reduction in triglycerides. 8% increase in HDL cholesterol. Mortality. More than 20% decrease in total mortality. The cause of obesity is multifactorial, but appears to be, at least partially, mediated through genetic mechanisms. Several environmental factors are known to development and maintenance. Metabolic, biochemical, psychic, social, cultural, and psychological. In most cases, it's the result of a positive energy balance. That is to say, higher caloric intake relative to daily expenditure. The strongest evidence indicates that the prevalence of obesity has increased as a consequence in energy expenditure, reduced physical activity. That has not been compensated by an equivalent reduction in food intake. Small, short-term variations in caloric intake are consistent with weight maintenance. Since dietary intake and physical activity, two of the modifiable causes of obesity, are the major contributors, the main goals of treatment will be aimed at establishing dietary and physical activity patterns that will lead to weight reduction and maintenance. The real success in treating obesity by changing eating and living habits for good, and the sooner the better. As in many other diseases, especially those related to diet, in obesity, prevention is fundamental, and this must start from early childhood. A child over 4 years of age who is overweight is much more likely to be obese in adulthood. Importance of physical activity. People who are active are generally less at risk for degenerative diseases, especially cardiovascular diseases, hypertension, stroke, osteoporosis, and perhaps also non-insulin dependent diabetes, type 2 diabetes, the adult onset diabetes, a metabolic disorder in which the hormone insulin is not effective because the tissues are relatively insensitive to its action. Type 1 diabetes, insulin dependent of juvenile onset, occurs because the pancreas responsible for secreting insulin ceases to do so. As a result, blood glucose rises and hyperglycemia occurs. Regular physical exercise also produces a greater sense of general well-being. Recent studies have highlighted the importance of physical activity in controlling anxiety, stress, and improving self-esteem. Exercise has an antidepressant effect. The effects on metabolism are well documented. Physically active people have higher blood levels of HDL cholesterol, are also especially effective at metabolizing glucose and controlling its concentration in the blood. Glucose tolerance, or the body's ability to regulate blood glucose concentration in response to insulin secretion, is better for up to 48 hours after exercise. Physical exercise also stimulates bone formation and inhibits bone loss. Bone mass in some areas of the skeleton is significantly higher in athletes than in sedentary people. In childhood and adolescence, physical exercise can increase peak bone mass, very important in limiting subsequent adults. In pre- and Menopause. Regular physical exercise can promote maintenance of bone mass and reduce the risk of fractures in osteoporosis. Osteoporosis is a disorder characterized by low bone density that increases the risk of fractures. In certain, particularly vulnerable bones, it occurs more frequently in women after the menopause. Physical activity, whatever its intensity, facilitates the expenditure of energy and therefore helps the diet in weight reduction. In addition, contributes to maintaining muscle mass and basal metabolic rate, which is always lost, to a greater or lesser extent when on low-calorie diets. 30 to 60 minutes a day of some form of aerobic physical activity, moderate intensity, which helps burn more fat, is recommended. Look for physical activities that are pleasant and that can be done on a daily basis. Walking at a brisk pace, using the stairs instead of the lifts, etc. Avoiding those that involve a lot of effort. Avoiding those that are a burden, that in a few days it will feel. An 80 kilograms person who replaces 30 minutes per day in front of the television by 30 minutes of light walking can lose or not gain more than half a kilogram of weight per month. That is about 8 kilograms per year. How 100 kilocalories are gained from regular food. 100 kilocalories are in 11 grams of oil, 1 tablespoon, 13 grams of butter, a small packet from a coffee shop, 16 grams of dried fruit, airline sachet, 19 grams of milk chocolate, serving is 25 grams, 20 grams of chocolate biscuits, 2 pieces, 22 grams of potato crisps, 26 grams of cookies, 5 pieces, 28 grams of uncooked rice, half a portion, 39 grams of white bread, 2 large slices, 121 grams of yogurt, 1 piece, 155 milliliters of whole milk, 1 medium glass, 250 milligrams of bottled juice, large glass, 365 grams of carrots, 4 medium, 390 grams of orange, 2 medium. If you're interested in learning more about clinical hypnosis, watch our next video, The Balanced Diet, the 5th part. Remember to study the description of this video, where you can find a link to free training classes about clinical hypnosis, with several ebooks also free of charge. If you have questions, ask them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, don't miss our next videos.